Hello. Today we're going to talk about the ethics of generative AI within healthcare. Firstly, let me just note that I'm not an AI expert. I'm a utilizer of AI, I'm an application specialist in how I use AI into my clinical practice, into my teaching, into my research, and my everyday life. So the other thing I want to say is that I'm going to base this lecture on three sources that I have generated with my colleagues and the team members. One is this chapter on the ethical guidelines and policy for technology in healthcare. That was a invited chapter by a textbook for medical equipment and engineering from London. And the other I'm going to use invited piece from Nature on how I mitigate, I look for and mitigate biases in large language models. The other is also another commission article for this healthcare management journal on humanizing digital healthcare. So overall, generative AI is here. Everybody has to understand that they have to cope with it, they have to use it, they have to imbibe it. And so generative AI is involved in healthcare from diagnosis to treatment to providing productivity and efficiency. And it's also very useful for data analysis, especially in research and also in teaching. So once you have an intervention or a process that you're incorporating into healthcare, which is going to impact patients' life, the ethical framework becomes very useful and very important and crucial. So the ethical framework we follow in healthcare is a bioethical. This infographic explains how the impact of generative AI in healthcare is from enhanced accessibility to efficiency, personalized care, and cost effectiveness. It is over the next year, we're going to see tremendous impact and integration of generative AI into all aspects of healthcare. All of us are going to be. And moving forwards, in this lecture, I'm going to confine myself to artificial intelligence and machine learning, which is what that affects all of us on the ground who are healthcare professionals. This is my area of experience and expertise. I will not talk about all the other areas in which technology impacts healthcare, blockchain, Internet of Things, telemedicine, genomics, and robotics. So we'll confine ourselves to AI. So ethical principles in healthcare, a lot of people have written about it, frameworks, governance level, and all of this becomes very confusing, but let's keep it very simple. The bioethics principles are do good, do no harm, respect the patient's autonomy, make sure confidentiality is maintained, and most important, social justice. The social justice is not in terms just only in the community, but we as healthcare professionals must be just to our patients, and we must not deny them technology that can improve their healthcare and well-being. So these are the areas from which you use this framework to work out how to use generative AI in your practice. So generally, in this, this is one of the synthesized infographic from our chapter in the book for engineers is the four areas that there must be accountability in the incorporation and integration of generative AI in the design and development. There must be transparency. It must be fair. The data that is being used to create the algorithm must be fair, especially to marginalized individuals, and fulfills the DIE framework, diversity, inclusivity, and equity. And it must have trustworthiness. And this is crucial, that there must be evidence-based trust validation of the responses so that the end users and stakeholders can trust the output. So why we use all these technologies for us to gather information and from data from multiple sources. From that information, we collect knowledge and then we have wisdom to help with our patient in shared decision making. And for that, these are the frameworks that's very important. You must have trust in the decision making process. You must have the ability to evaluate all data and be able to communicate with confidence to the end users, with all the stakeholders on the reliability of your decision based on information from generative AI. And here is where we need to balance between the real needs versus the intervention. So AI can undermine the shared decision-making process if certain criteria are not fulfilled. The patient's condition must be totally and fully understood by the doctors, and this is where the doctor must be able to summarize, to crystallize and synthesize the problems, concerns and expectations of the patient in a useful prompt to help him with or her with the decision that is going to be obtained from generative AI. Then you must be able to trust that evidence. And how do you trust that evidence? How do you validate that evidence? And this we spend a lot of time in our workshop teaching healthcare professionals on how to first prompt the generative AI to get the outcome, the response, and from which to get evidence to validate that response using literature review. And again, this is with the help of generative AI. And to assess the benefit and risk. And here, high-level order thinking from generative AI like ChatGPT 401 preview is providing high-level thinking, and then we use our real intelligence, our expertise, to balance that view and see whether it makes sense before transmitting this or articulating this and communicating with our patients. And this is the important slide which shows on how we do evidence-based validation. We start off with the prompt that we put in, that we want advice or we want confirmation from generative AI, and the generative AI produces certain outputs. We have to then take that output and see whether this output makes sense, is it authentic, it is relevant, and you as the expert should be able to say that. If you find that you are not sure of the output, that's when you extract the central themes and terms from that output and put it into a search engine, the database and evidence-based, that is PubMed, Google Scholar, Web of Science, and from which you then do a literature screening, just like which we do any other literature review. We can use generative AI to speed this process up, and I show in our workshops how the participants can do a quick literature review in 7 minutes. And from this, we gather and we extract the data from the included studies, validated studies in the literature, peer review, and synthesize the finding. And then we compare those findings with that of generative AI output and look for similarities. So in the design and development of application software, it is very important that the ethical framework is incorporated very early. And this is why I always think that the evidence is very clear that we must incorporate clinicians within the design and development team from day one so that they understand the bioethical framework that needs to be abided to in the development of these various large language models. And we must ensure there's diversity, inclusivity, and equity is incorporated into the data that is being used to create algorithms. Now, the collaborative model is what I think is very useful, where we need to ensure that we include all stakeholders in healthcare, in not only just the clinicians, but bioethicists, we must include technologists, we must include computer scientists, and not forgetting the patient. But you must be careful on what you interpret the findings from generative AI. Recently, we were discussing on an important topic in Singapore, in the National Medical Ethical Council, on gender dysphoria. And I noted some participants had used generative AI to generate their responses, and they just cut and paste, not understanding that generative AI is generally very Anglo-centric, very Western-centric, and so the ethical framework that it will use to help you write and craft your comments is a Western. And so we have to be cognizant of that fact and incorporate Asian and values, ethical systems, and religious context within our community. So there becomes the meta-ethics. So here is where the belief system of the community needs to be taken into account. What are the values? And some of this has to be very careful. There is a conflict between the Western and Asian or Eastern philosophies, things like dualism and non-dualism. And these are things that need to be discussed prior to execution. And so how do I use generative AI in my practice, and how do I overcome some of the ethical challenges that I face. So I've taken a mission upon myself to do training and education. So over the last 2 years, with my partnership with the UNESCO chair at Asia Pacific University in Malaysia, we have trained over 5,000 people, mainly educators, on incorporating generative AI. And this has been shown in our literature reviews, one of the important aspects on the ethics of incorporating generative AI. By working with my team at the UNESCO uh, chair, we have developed certain ethical framework incorporating Asian value system, our own religious beliefs, and so as to be more aligned to our community. And I also make sure that we involve patients. In one of our studies, we are engaging patients on the usefulness and usability of a screening tool using generative AI for carpal tunnel syndrome. It's been using a grant. We're going to try and do that. So incorporating patients into it. And to make my life easier, I have designed and developed an ambient clinical recording app that helps me with my significant pain point of typing into Epic, which is our EMR. So this is very useful and how I use it in an ethical manner for my use. Moving forwards, I think there's a need for interdisciplinary collaboration, and I explain training and education is very, very crucial because clinicians, stakeholders need to be trained. And I take that upon myself to try and do as much as this as possible. We are also, to make it sustainable, we are using train-the-trainer programs to ensure that 10% of our participants volunteer to be trainers so that we can train them and this can move forward. Hopefully by next year, most of the stakeholders will have some awareness and some training on how to use generative AI in their practice. Now, governance and regulatory considerations are important, and I think this is where we need to incorporate all stakeholders in a collaborative approach towards designing and developing governance frameworks. And there must be standardization, there must be government and regulatory bodies need to take an active role in engaging everybody to create this. But very important to realize this cannot be a static document, this needs to be a dynamic document as technology is changing. Uh, in this domain, it's the first time in my life that every time I give a lecture on the same topic, I have to review my slides because technology is changing so much. And Singapore has got its framework, and these are the main things. It's worthwhile reading it. They are one of the leading countries in the world with a rather robust governance framework for AI. Now, we must also look at social technical impact and the ethics, and this has to be on an anticipatory basis. And I feel that experts need to sit down and anticipate what are the possible outcomes. And here is where we may need to use sociologists, other transdisciplinary professionals to help us in this. And we need to then make it a multidisciplinary dialogue. I believe it's very important not just integrating empathy in digital healthcare, but also to be aware and sensitive to the cultural uniqueness in the local setup. So though we can have generic global kind of frameworks, but we have to localize it to the local context and community. And in conclusion, I think collaboration and research are crucial, and continuous education and integration of AI is important as we move forward in healthcare. Thank you and good luck.